Hi everyone, and welcome to tonight's discussion on gut health and how this not only affects how we go to the bathroom or what kind of bowel movement you have, but more importantly, how gut health affects our immune system and our ability to stay healthy and free of illness. I'm going to do my absolute best tonight to explain everything as thoroughly as I can, but in a way that you all can comprehend. I'm so appreciative and thankful for being here tonight, and I would like to give a big shout out to Bonnie for making this all happen. So hopefully you can learn a few things or two tonight as we go through the discussion, but please feel free to just sit back, relax, and enjoy the presentation. Please don't worry about writing everything I say down. I will provide a tip sheet in the end. So let's get moving. So how did I get here? When I say here, I'm talking about functional integrative medicine. Sometimes I wonder too, because in the early part of my nursing career, I practiced traditional medicine. I started out of school as a registered nurse in one of the busiest trauma units in the country. We would see the worst of the worst: gunshot wounds, stabbings, car accidents, any trauma you could really think of. I'm sure you all have seen Grey's Anatomy or watched Grey's Anatomy in the past. That was my life for 6+ years. Well, minus all the sex and all the drama, but you get the picture. I am the person who always wanted to help in whatever way that I could, and this is likely why I became a nurse. I also am the type of person who pushes to gain more education and understanding as to why things are occurring. I decided after experiencing all the adrenaline that I could possibly handle that I would go back to school and become a nurse practitioner. At this time, I also made the decision to leave the trauma world and enter medical intensive care. As I was working on my master's degree, something just wasn't sitting right with me about the medical system and how it was changing. I felt like it wasn't really helping people with chronic illness, or even keeping people well for that matter. This led me down the path of functional integrative medicine. I was actually doing more studying and more work with functional medicine than I actually was for my required coursework in my master's program. My wife at the time thought I was absolutely insane for taking all this on, but to me, I had to do something that was really fulfilling, and that was functional medicine. So after I graduated, a few months passed by, and then I ran into Dr. Lewis, and the rest is history. So we have a lot to discuss tonight, and I have listed a few things above that I would like to accomplish tonight. First, gaining a better understanding of the GI tract and how it works functionally. What does a healthy GI tract even look like? And how do we get to a better state of wellness? We will also discuss the enteric nervous system and how this so-called gut-brain axis affects everything we do in the body, not just the brain and the bowels. We will talk about certain ways we evaluate gut health at Sancta Familia Center and what testing methods we use as well. We will discuss the gut and keeping it healthy and how it's related to treating PANS and PANDAS, and how a poor gut can worsen symptoms of PANS and PANDAS. Lastly, we will finish with a case study if time permits, in which I will walk you through how I work a patient up coming into the practice. I love this quote. It's very simple and succinct, but so true in regards to how functional medicine practitioners look at health and wellness. Hippocrates was a Greek physician back in 400 BC and was actually considered the father of modern medicine. Almost 2,500 years later, this quote still stands true and hasn't changed one bit. Hippocrates viewed health as too much of something that shouldn't be there, or not enough of something that needs to be there. We have to get that in balance to be healthy. The GI tract is an extremely important system in our bodies, but very much underappreciated for all that it does. Digestion actually begins with mastication or chewing. Enzyme-rich saliva is produced when you chew, breaking down food so it can move down the esophagus and into the stomach. Since saliva contains antimicrobial substances, it aids the immune system and the body to stay healthy and is considered our first line of defense. Think about that for just 1 second. It's pretty amazing. Once food enters the stomach, gastric juice breaks down food even further, and this is where key nutrients begin to be extracted. Most of these key nutrients and vitamins from the food or drink that we are consuming are absorbed in the small intestine, which is the next tract in the GI system. If we are manipulating stomach acid with antacid drugs or medications, this actually changes how we functionally digest. This occurs way too much in modern medicine. People are prescribed medications which should only be taken for 4 to 6 weeks, and they are on them for years and years to treat GI reflux or GERD. And this is why I never prescribe, and if I do, for very short periods of time, antacid medications such as Prilosec, Zantac, or Pepcid. If our stomach acid is too alkalotic, or meaning the acid is too low, we cannot break down fat, which causes issues downstream in the digestive process and puts a tremendous strain on our gallbladder. Probably why so many people have their gallbladders removed. If one presents with acid reflux in my clinic, my first question is always, why are they having acid reflux? I will never just place a band-aid over something and forget about it. So once food enters the small intestine, it is here that it mixes with bile and pancreatic enzymes. Bile actually helps break down fat even further. Most, if not all, absorption occurs in the small intestine. The remainder of the food enters the large intestine, which is lined with trillions of bacteria to further digest food. This is also known as our microbiome. Anything that cannot be digested or absorbed, you guessed it, turns into poop and enters into the rectum and into the toilet bowl. So what is this thing called the microbiome? I'm sure you have heard of the term before on a commercial or if you've taken probiotics, but what exactly is it? Well, it is simply an internal ecosystem of bacteria, fungi, parasites, which contains nearly 35 trillion, yes, trillion bacteria. This amount of bacteria weighs nearly 6 to 10 pounds of your own body weight. Any imbalance in the microbiome is known as dysbiosis and may be the root cause today of most chronic inflammation. So what things can affect our microbiome? What things can deplete them or cause them to develop bad bacteria? Well, two of the biggest areas that affect microbiome are: how were you born? Were you a vaginal birth? If you were, then you were inoculated with very beneficial bacteria as you entered your mom's birthing canal. C-section babies do not have this benefit. I once had a GI doctor, he was the dad of one of my patients, that told me his son was born C-section, and he knew of the importance of the microbiome and how important it is for health. So he actually took a swab after his son was born, swabbed his wife's vaginal canal, and then swabbed his son's nose and put the swab in the child's mouth to kind of get that healthy start to the microbiome. It's kind of crazy, but it worked. But going back even further, your microbiome develops when you are actually in utero. So if your mom is healthy when she is pregnant with you and has a very healthy GI tract, then this correlates to a healthy passive transfer of bacteria to the baby. This is why there's so much education put to stay healthy as a pregnant woman. The last birthing effect on the microbiome is breastfeeding. This is considered one of the most important and actually the first prebiotic we get as a baby. Prebiotics are very important because they help feed and grow beneficial bacteria in the colon. So think about that for 1 second. All of those things I mentioned are occurring within weeks of life, and they can help determine if you are going to be healthy or suffer from chronic illness. Another area I frequently see is the overuse of antibiotics early on in age. I had one parent come in and tell me her child was on amoxicillin 75 times before the age of 6. This likely destroyed her child's gut and microbiome and led to years of stomach pains, inflammation, and illness throughout his childhood. Stress, diet, medications, and even where you live can put a strain on your gut health, especially in high areas of industrial work, coal plants, or even farms using herbicides. Toxins will certainly cause inflammation. I'm not going to spend too much time on this slide, just a couple of tips to maintain a healthy microbiome. Main point here, eat the rainbow in vegetables. Our microbiome will diversify, which is what we want when you eat different foods. We will get more into probiotics and prebiotics in the next few slides. We will also discuss the impact of antibiotics, which is a staple treatment of PANS and Pandas, and how we can mitigate some of the negative side effects of antibiotics during treatment. Okay, leaky gut. Leaky gut is one of my favorite things to talk about. So, leaky gut is actually a clinical syndrome where the villi and microvilli of the small intestine become flawed and damaged from poor diet, high inflammation foods, kind of like our standard American diet, toxins, abnormalities in digestive processing. And so when these little tight junctions of the villi are damaged, undigested food particles, as you can see in the picture, toxins and bacteria leak into the bloodstream, causing very systemic effects. Since about 70 to 75% of our immune system is found on the GI lining of the gut, permeability like this triggers massive inflammation, not only in the gut and the body, but also in the brain. Leaky gut equals leaky blood-brain barrier. Let me say it again. Leaky gut equals leaky blood-brain barrier, meaning many of the toxins and bacteria that enter the blood will then enter the brain, which will cause massive inflammation. This becomes very cyclical and very problematic for patients who are already dealing with an inflammatory process, such as, you guessed it, PANS, and any other autoimmune disease. If there is excessive inflammation in the gut, it translates to compromised immunity. SIBO, or small intestinal bacterial overgrowth, is a disorder where larger numbers of normal bacteria form in the small intestine. Patients can have a myriad of symptoms: heartburn, reflux, abdominal pain, cramping, diarrhea, constipation, excessive gas, and then some other systemic symptoms such as fatigue, joint pain, headaches, or skin problems. Sounds like most people. Diet plays a large role in the recovery process. Bacteria primarily consume carbohydrates, so most diets for SIBO are low carb to reduce fermentation food supplies for opportunistic bacteria. You may consume insoluble fibers, however, stay away from starches, soluble fiber, sugars, and prebiotics, as these will definitely make symptoms worse. Generally, SIBO is diagnosed on breath testing. But this is very cumbersome and has very, very many false negatives. High levels of bacteria on PCR stool testing is consistent with overgrowth as well. So this is how we test for SIBO in the clinic. Traditional treatment is to use antibiotics such as Xifaxan, which is thousands of dollars. So we tend to use herbal agents that are just as effective. Constipation can be a big problem with SIBO and can cause resistance to treatment due to the negative effects SIBO can have on motility in the bowel. So what we do is restore daily effective stooling, and we may use things such as magnesium oxide, magnesium citrate, or L-carnitine to kind of help with having these daily effective bowel movements. Have you ever gone with your gut to make a decision or felt butterflies in your stomach when you're nervous? You're likely getting signals from your second brain. Hidden in the walls of the digestive system, this enteric nervous system controls digestion, mood, health, and even the way you think. Your gut and brain are also connected through chemicals called neurotransmitters. For example, the neurotransmitter serotonin contributes to feelings of happiness and helps control your body clock. Interestingly, about 90 to 95% of your serotonin is produced by your gut cells and the trillions of microbes living there. Your gut-brain axis is also connected through your immune system. Gut and gut microbes play an important role in your immune system and inflammation by controlling what is passed into the body and what is excreted. If your immune system is switched on for too long, it can lead to inflammation, which is associated with several brain disorders, especially PANS. So how does your gut and brain communicate with one another? Your gut and brain are connected physically through millions of nerves, most importantly, the vagus nerve. Your vagus nerve is considered a cranial nerve and is responsible for keeping the body in a parasympathetic state, meaning rest or relax. All too often we see or treat children who are stuck in a sympathetic state or this constant fight or flight state. The stress of chronic illness has a very negative effect which triggers changes at a cellular level and in the autonomic nervous system that can make it hard to shift from an ill state to the healing state and then to the well state. We can reverse this state of being by rebooting the brain with TLP, brain tap, DNRS, or vagal nerve exercises. Each one of these modalities will help to create a safe signal in the body to allow for healing and will actually expedite the process of healing for individuals with chronic illness. So let's switch gears a bit and talk about how and why we test. So if someone is presenting with any one of the symptoms we mentioned in the previous slides, or are dealing with anxiety or depression, or tell me they are frequently sick all the time, this to me is grounds to look at GI stool testing. Now there are many different tests out there, and they all range differently in price in what they actually test for. Some, depending on your insurance, can be partly covered. Some are not covered and are very expensive. If you have TRICARE, Medicare, or Medicaid, we will likely use doctor's data. The Genova Test is one of my favorites to run due to the comprehensiveness of testing. As you can see, testing is broken down to certain areas of digestion, inflammation, overgrowth, or imbalanced bacteria, metabolic imbalance, and infection. It will also give me markers for leaky gut, SIBO, bacterial dysbiosis, inflammatory bowel disease, IBS, and also tell us whether there is blood in the stool. I, as a practitioner, can certainly gain a lot of clinical insight looking at the results and make a step-by-step treatment protocol using this information above. Pancreatic elastase is very important to know. If this level is low, meaning less than 200, it can be a sign of exocrine pancreatic insufficiency. We need to seek primary causes for such a thing as pancreatitis, gallstones, diabetes, celiac, which is a big one, inflammatory bowel, and even cystic fibrosis. Next, we look at protein and fat breakdown. If these levels are elevated or high, it could signal to the body that it's having a difficult time releasing enzymes from the pancreas to break down protein, fats, and carbs. Generally, people respond very well to taking digestive enzymes. If we are not breaking down food functionally, we do see lots of reflux and GERD, not to mention the strain this puts on the GI tract downstream. There are a few inflammatory markers. Generally, if calprotectin is high, this is a pretty solid marker of inflammatory bowel disease. So, things like Crohn's or ulcerative colitis. If moderately elevated, it can signal chronic NSAID use, which we use quite a bit in PANS. If the EPX is high, the gut may be sensitive or allergic to certain foods we are eating. Gluten, casein, corn, eggs, etc. If SIGA or SIGA is elevated, this could be a sign of GI immune upregulation in the gut. Once again, we need to look at the root cause and rule out infection, bacterial infection, viral, parasites, yeast. A compromised intestinal barrier such as leaky gut, food sensitivities and allergies. Many times SIGA will be high with mold illness, which certainly can trigger PANS symptoms. The metabolic portion, all the way below, looks at short-chain fatty acids and N-butyrate. This will tell us if you need supportive agents such as inulin, probiotics, and prebiotics. Dietary modifications to increase pre- and probiotic foods cannot be emphasized enough. Diet, diet, diet. Short-chain fatty acids are so important to maintain intestinal integrity by strengthening the gut barrier function and protect against inflammation. Commensal bacteria is considered neutral. It is neither negative or positive, but acts on the immune system to maintain protective responses, such as preventing colonization and invasion by bacteria. When commensal bacteria is elevated and tips the scale in the wrong direction, we see overgrowth, mainly in the small intestine, which we talked about already. Ideally, we want to see all levels in the green, right in the middle. Lastly, we will look at cultured bacteria and yeast if present. The Lactobacillus, E. coli, and bifidobacteria are considered all forms of beneficial bacteria and should be in the +3 to +4 ranges. Additional bacteria is considered negative bacteria that should not be present. This is where the term dysbiosis comes from. Too much bacteria here will lead to chronic inflammation and a myriad of gastrointestinal symptoms. Mycology is just considered the medical term for yeast. So, we get all this information from testing, but how do we go about healing, sealing, and repairing the gut? The answer is very systematically. First, we remove or kill bad bacteria or dysbiosis, yeast, parasites, and any other pathogen. We also remove foods that can be problematic, such as dairy, gluten, any other things that you may have food allergies to. Second, we replace. We replace with digestive enzymes if there are concerns with pancreatic elastase or protein or fat breakdown. If a patient has been on an antacid medication for years, we may need to give them hydrochloric acid to increase stomach acid, because once again, you cannot digest without acid. Third, we reinoculate. Reinoculate or replenish beneficial bacteria with pre or probiotics if needed. We will know which strand of bacteria and how much you will need based on testing. Fourth, we repair. We repair the gut lining and the integrity of the gut wall. We fix leaky gut by addressing permeability issues. And last but not least, we rebalance. Rebalance lifestyle to decrease stress. We focus on better sleep. We exercise as tolerated. We correct our diets. A healthy, rich diet in plants and fiber, prebiotics, probiotics, produces a very favorable shift towards a more anti-inflammatory species and increased bacterial count in our guts. Can you see the theme yet? Certainly, we have mentioned the word probiotic and talked all about these great benefits, right? I know there are some of you out there that are thinking to yourselves, Nick, come on, man. I've tried probiotics and my kid just does not tolerate them. Better yet, every time I give my kid a probiotic, it induces a PANS flare. I'm not buying that probiotics are good. My response? Why? Why is he or she not tolerating them? Are they the right ones? Have you tested stool to know what to use or what strands the child is deficient in? Or are you using products from the local drugstore or Kroger or your grocery store? Products that may not be third-party tested. Did you know one of the most common causes of PANS is strep? Nick, of course I know that. Well, did you know that the vast majority of probiotic products, including yogurts, contain a certain strain of bacteria known as strep? On the label, though, the product, it is listed as S. thermophilus. Many children will flare from this strep strand. Mind blown, right? Unfortunately, there are few and far between yogurts or supplements, or probiotics I should say, without strep in them. We must be careful when adding these things into our diet or our pill box. So this slide is just more of an overview of PANS and Pandas. I'm sure most of you in the group tonight have a pretty firm understanding of what PANS and Pandas is, what it stands for, and the cascade of symptoms that we actually see when we're treating children who are dealing with this inflammation. So you can review these on your own time, but we'll kind of keep moving. Is gut health really that important for PANS and Pandas? Short answer, yes. Yes, yes. But Nick, PANS is a disorder of the brain, not the gut, right? Well, this is true in a sense, but hopefully you have seen in the previous slides how this thought may change. If you think about our immune system, 70 to 75% of our immune system is located on our gut lining. PANS is a disorder of the immune system, causing massive inflammation and a sequela of symptoms. It makes sense if we are supporting the health of the gut, we are supporting the immune system itself, which will then get PANS into remission that much quicker. If you think about some of the cornerstone treatments that we have for PANS, what are they? Well, ibuprofen or other types of NSAIDs, steroid bursts of prednisolone for the younger kids, and antibiotics. Without these treatments, we can't get symptoms of infection and inflammation under better control or into remission. The downfall? All three of them destroy gut tissue and integrity. So how do we mitigate these negative side effects? The answer is we never take our focus too far from our gut. We correct, we heal, we seal the gut lining. Then we maintain through proper diet, making sure we cut out inflammatory foods such as gluten and dairy. We eliminate any allergens, foods that we may have certain sensitivities to, such as eggs. We eliminate carb-heavy diets and incorporate fresh, organic whole foods, such as fruit and vegetables. We eat the rainbow, not Skittles or M&Ms. We eat the rainbow in vegetables. We add in probiotics or beneficial yeast, such as Saccharomyces boulardii, especially when we are on antibiotics to help replenish that beneficial bacteria. We prevent constipation, which in itself can lead to behavioral issues in young children. If we are not pooping on a daily basis, we are not getting rid of toxin on a daily basis, which leads to a body overburdened by toxin. We treat parasites if present. We treat yeast if present. All of these things we take into account when treating children with PANS. There is no doubt months to years of these treatments will eventually cause issues in the GI tract if left unnoticed. The key is to be proactive before we even start antibiotics or anti-inflammatory medications, and never lose sight on how important this vital organ is to our body. At Sancta Familia Center for Integrative Medicine, we offer a comprehensive integrative approach to medicine and are here to walk you through your health journey with you together. So, what makes our clinic different from every other that you have gone to in the past? Well, I feel it's the people who work here. We are a ministry of healthcare providers focused on healing the body, the mind, and the soul. During your initial appointment, you will spend about 1 to 1.5 hours with your provider who has already reviewed your extensive health history. We go over everything, starting with the early years of life to current day. I normally warn people we are extremely detailed and intentional with all our questions. We are very professionally paranoid about things that many practices or providers do not look for, such as Lyme, mold illness, mast cell activation syndrome, gut health, and dysbiosis. Many of these things are major triggers for PANS flare, so we need to look into them. After your visit, you will meet with one of the nurses who will recap the visit and answer any questions you have. At this point, if there's any testing being sent home, the nurses will review with you how to perform the tests. We have a patient portal to stay in touch with you at all times. We want you to use it. After about a week or so after your first visit, you'll have a scheduled coaching call with one of our staff members to ensure that you're on track to be successful. Remember, integrative medicine is drastically different from traditional medicine. We see all follow-up appointments generally 3 to 4 months after the initial appointment. This gives the providers plenty of time to review labs, testing, and put together a very in-depth and detailed plan for your child. Once you receive this program, We then set you up with a liaison phone call to ensure compliance and keep you on track because it's quite overwhelming sometimes. We do all this to ensure patient success. Many families ask, why are the appointments so long? The answer is, it allows us time to listen and hear your story. The body is truly incredible and knows how to heal. We just have to listen as providers and understand what the body is saying, because many times when you truly and actively listen, you will understand the root cause of all illness. Our bodies are so smart. The symptoms a patient has is what the body is telling us is out of balance. Healing just takes someone who wants to listen. This ends our talk tonight on gut health. I hope you enjoyed it and took a few pearls away with you that you can use for your children. I will now open it up for Q&A. Thank you, everyone.